Okay, well, we will go ahead and get started. And I have the pleasure of introducing our speakers for today. So welcome to this Connect to 528 call. Today, our speakers are Dr. Brandon Crawford and Sharik Peck. And I will just read some brief introductions of them. So Dr. Brandon Crawford is a board certified developmental functional neurologist and global expert in laser and light therapy, photobiomodulation, specializing in its use within functional neurology. As clinical director of NeuroSolution ATX, his innovative work transforms transforms lives, particularly in treating traumatic brain injuries and optimizing brain function. Dr. Crawford has expertise in co-activation for photobiomodulation, and it's earned him a global audience where he lectures on groundbreaking treatments for neurodevelopmental disorders, chronic pain, and traumatic brain injuries. In addition to his clinical work, Dr. Crawford is the co-founder of 528 Innovations, a company born from the gaps he identified in existing products for his patients. 528 Innovations is pioneering technology that standardizes laser therapy care by offering a safe, reliable, and science-based system. Our advanced user-friendly platform provides precise guided treatments while remaining adaptable with easy-to-upgrade features. With over a decade of experience, Dr. Crawford continues to advance healthcare with his holistic, science-based approach to therapy, leveraging his expertise in biomedical science, human anatomy, and health and wellness. And then we have Sharik Peck, a physical therapist, is the founder and inventor of the Rezzimax Pain Tuner, a Utah-based company that offers a non-pharmacological solution for chronic pain management. With approximately 30 years of expertise in physical therapy and a master's degree in counseling, Sharik's personal journey with severe injuries, including a broken neck, broken back, and a stroke, inspired him to create a device that helps balance the nervous system.
Oh my God.
Drawing from his experiences and natural healing power of the vagus nerve, Sharik developed the Rezzimax Pain Tuner, an elliptical resonance device that uses precise harmonic frequencies delivered through acupressure points and gentle external contact to help the body restore balance, offering a groundbreaking and user-friendly solution to pain relief. So welcome, Dr. Brandon Crawford and Sharik Peck. We are excited to have you here this morning and want to offer just a quick disclaimer. That will be on the screen in just a moment. But Dr. Crawford's stories and experiences are reflective of having used lasers in his practice and is the basis for the development and manufacturing of the new 528i laser therapy system. So the lasers that he's talking about today are in manufacturing and have not been used in the cases that he describes.
But I am using them on my brain right now.
All right, so perfect. Brandon, I will hand it over to you to talk about how you and Sharik know one another.
Fantastic. Thanks, Megan. Appreciate all that. Thanks for all your organization, you and Jackie and everyone with the 528 team really putting all this together. Anytime you try to get a lot of people together at one time from multiple time zones, it can get a little messy. So I really appreciate all of y'all's work. I think y'all did a brilliant job. I'm super excited today. I know we had, I think we actually had to close this event, right? I think we had so many people that wanted to attend. We actually ended up having to close it, which is awesome. So I'm so excited to know that so many people want to know more about what we're doing. And I am beyond thrilled to be talking with one of my favorite humans on the planet, Dr. Sharik Peck. Sharik, man, I don't say that lightly. You really are one of my favorite people. Your story alone is just beyond amazing. You know, your own recovery and as Megan was going through the introductions, I mean, I think we could really summarize it like we're just two guys on the planet that have a purpose and a passion to help others, and we're doing that through not just through our skill sets, you through your background of physical therapy and all the other things that you do, and me through chiropractic and now developmental functional neurology, but through innovation, right? Really pushing the boundaries in medical technology, really just truly trying to help people live the best lives that they can possible. When I first met you, man, I'm trying to go back into the recesses of my brain. It's been a minute. I remember connecting with you at one of the IAFNR events. So it was the International Association of Functional Neurology and Rehab. And I remember Dr. Trayford, he comes up to me and he says, "Hey, you've got to come meet this guy. His name's Sharik. He's got this really cool device." And I was like, great, another device. Here we go. And I was there with my wife, and she's always had chronic TMJ issues. And she would have these TMJ, this TMJ pain that would turn into a raging headache. And we could do things with it. I would strip her jaw. We would do various things. And I brought her over to you, and you're like, "Oh, yeah, we can knock that out." I was like, "Well, how long is it going to take?" And you're like, "I don't know, 2, 3 minutes." I was like, "Come on." And you show me this device, right? And you put a glove on it, and you have her put it in her mouth, and you do some cycles with the Rezzimax, and she's opening her mouth doing your TMJ protocols, and she takes it out, and she's like, "Brandon, my TMJ feels so different. Like this is amazing, right?" And so I'm watching the whole thing transpire, and I'm sitting there going, "Wow, trigeminal stimulus, vagal stimulus, pain." I'm like, "Oh my gosh, you just lit up the brain. Okay, I got to know more." And that was really how we met. And then, of course, you came and you lectured with us in the developmental funk neuro course, and it's just been amazing, watching you navigate this space and how you really transform lives. And something I really appreciate about you, my friend, is you're always willing to go out on a limb to help someone. Like if there's one of our patients and they want to get a Rezzimax and they need help, they need something with whatever, like you're there to help them. I'm just so appreciative of that. So thank you so much for joining us. I really, really do appreciate your time.
Thank you. It's an honor to be here. Thank you for inviting me to be here with you. And it's so exciting to see many names of people that I know from all over the world that have joined us. So this is so fun. It's great to be here with you. And I do honor and share your story. There was one slight exception, and we met in Las Vegas. But unfortunately, the man who had begged me and begged me to get there so that I could meet you and many others, Dr. Trayford, was not able to be there that year. He actually had a different event to be to. See how memories kind of restructure and change themselves. But the reason why it's so transformational for me, this memory, is I hate going to Las Vegas. I spent the first 6 years of my life there, and I didn't want to go, but Dr. Trayford said, "You've got to go. You've got to meet several friends of mine. You've got to, I will tell them that you're coming, and you need to show them this technology." And it was just the most amazing event, because for 2 straight days I didn't have to tell anybody what my device was designed to do. You guys all knew it. And suddenly I realized I have found a home in the functional neurology world, because here I have brothers and sisters that understand getting the brain back on balance, getting the nervous system and the vagus nerve to function optimally. And I was so excited to be there. So that memory is emblazoned in my mind, along with meeting you and your dear wife and so many others. It was a tremendous experience.
I second your opinion on Las Vegas. Talk about a blue lit microwave oven, man. I don't like the bright lights. I don't like all the non-native EMFs coursing through our bodies, the smoke, the noise. Ugh. Yeah, no, thank you.
But
Oh
it was
man.
magical there, wasn't it? It was a
Yes.
magic couple of days. It was amazing.
Yes. Absolutely. Absolutely. Well, so the main topic of today is going to be revolving around pain, but then this concept of co-activation. We've had several people send in questions. What I'd like to do first, if it's okay with you, is just kind of give an overview about what I mean when I say co-activation, because I think that would kind of help people understand what I'm talking about and also understand why it's important to use something like the Rezzimax in combination with photobiomodulation. So this concept of co-activation really began to resonate with me whenever I was reading a paper that talked about how photobiomodulation has a greater influence over tissue that has increased metabolism. So I started thinking about that, and it really started to make me think about chronic pain, because with chronic pain, oftentimes you'll start to see reduction in blood flow. You'll start to see dysfunctional autonomic tone. So your blood vessel tone begins to be abnormal, and your tissue begins to, lose its fragility. You start to, it just starts to wither away, for lack of better words. I'm going to try to stay non-medical here. And so as I was thinking about that, I was like, well, wait a minute. If photobiomodulation can have a greater influence on tissue that has a higher metabolism, then why aren't we activating the tissue that we really want to specifically target? That made more sense to me. And it made more sense to me both in the body, but then also in our nervous system, right? So if we have an area in the nervous system, whether it be a peripheral nerve, whether it be a brain region, whether it be enteric nervous system, right, for the gut, the organs, these types of things, wouldn't it make more sense to increase our specificity so that we could, when we use that laser or light therapy, we could actually be targeting the tissue that we want to have a greater influence on? And so that's really the concept of coactivation, is let's increase the metabolism, increase the blood flow, increase the cellular energy demands in the tissue that we want to specifically target more, right? And so that's why I absolutely love using the Rezzimax, not just on myself, but on my kids, on my wife, on my patients, before and during doing photobiomodulation, just to really enhance the overall experience, the overall results and outcome for photobiomodulation. So that's what I mean when I'm talking about co-activation. I don't know if you would like to elaborate on that, or give your version of that. What do you think?
I'd love to share just one thing to maybe add to that. And it's just a simple analogy that makes sense to me. I think of it as when a person has a brain injury or has a developmental problem, they've got phone lines that are not communicating correctly. In the old-fashioned time of phone lines, you had to take a line from one house to another house so that the communication could occur. In our modern world, that's a little bit different. It's more like our brain functions, I believe, where, synapses are just taking messages all over the place. But the problem for most of us is a communication problem between parts of our body and organization of the brain to be able to take that information, categorize it, classify it, and spit back out movements that the body needs to make, or actions that it needs to make in terms of memory, in terms of language. And so it's an organization thing that co-activation helps make happen. It's all organization in the cerebellum and organization in the different levels and lobes of the brain. And all of that organization is what the co-activation can help enhance, so that we can communicate very easily with all parts of the system.
Absolutely. And I love your explanation there, because I think most of us on here understand what phone lines are, but you're right. I think the younger generations are going to be like, what are those? But you're right. I think it was you that said sensory organizes our brain. I believe that was a tagline that I heard from you lecturing one time. And you're absolutely right. So that's brilliant. Absolutely. I believe it's a good time to go ahead and jump into some of these questions, unless you want to elaborate further on anything else. Is that okay?
No, let's go for it.
Awesome. Megan, do you mind helping us out with the first question?
Of course. Um, Someone wrote in and asked if you have any success stories with spinal stenosis.
Oh my gosh. Yes. Okay. So we could probably spend an hour on this one. Um, I'm going to let you go first if you want, or if you want me to go first, either way.
No, from my aspect, we have great success with this by waking up the nerve endings from the tips of the toes all the way to the brain. And we have to reorganize that communication. So if a person comes in with stenosis, I'll probably start at the feet and just start working our way up using the side wings on our device and organizing that information, but especially in the area of damage. We have long-term phone lines that are down. We have poor communication through there and chronic pain messaging. So we're just going to help organize that messaging, and that helps the body find positions that it can help remediate a lot of the back pain. Now, this is enhanced tremendously by what Dr. Crawford is going to explain.
So yes, and actually what I'm going to do is talk about a little bit about some of my story because you actually helped me. I wouldn't have like a degenerative stenosis, me personally, although I've helped with that, but I had a disc injury, which obviously was causing a type of stenosis. And for everyone listening, a stenosis is essentially a narrowing where those nerve roots come out of the spinal cord. So it's like encroachment upon the nerves coming out of the spinal cord. Typically, it's because of degenerative changes like arthritis, disc narrowing, bone spurs, that kind of thing. But it can be for various reasons. And Sharik was actually in my office that week, and I don't know if you remember, I was in a not a good place. I was in so much pain. It was awful. And what he did exactly what he just said. So he took the Rezzimax and started to use it on my feet, up the legs, etc. And then he placed it in the small of my back and had me actually, like if these are my legs, I was actually making my legs go like this. I was keeping them straight and it was essentially mobilizing my pelvis while he was running one of the Rezzimax cycles on my lumbosacral junction. And after that, I got up and I used the lasers over the L5S1 nerve roots, which is where that stenosis was. And it literally on the spot reduced my pain by about 75%, which is a really good way just to speak to the concepts of what Sharik was going through is, this is not just this one local phenomenon, right? This is not just about what's going on in that stenotic region. This is a full nervous system experience. And so by what he's talking about, getting the phone lines connected and everything, we're talking about this full integration of the brain and the nervous system and helping you to mobilize better and actually overcome this pain syndrome. That was a huge benefit for me. I've replicated that in other patients and it's worked very, very well. Now, of course, there's going to be some limitations sometimes. I've gotten to really see this by working with Dr. Madeira. She's our medical director. She's a neurosurgeon, but she specializes in spine. So, sometimes we see the worst of the worst of the worst, and sometimes some surgical intervention, of course, is unavoidable. But by using strategies like what Dr. Peck just outlined and then throwing some laser on top of it, I've seen some amazing changes.
Okay, excellent. So we had a question come in about let's see, need a protocol for bone degeneration pain for hip and shoulder.
Okay.
So if you could talk about that.
Bone degeneration pain, is this more of like an osteoarthritis type of question, or is this more of like osteonecrosis, or do we know?
We don't know.
Okay. Okay.
This came through
Well,
with the registration. Yeah,
gotcha,
not on the
gotcha.
call itself.
Okay. So almost a similar discussion, right? I mean, if we're talking about a shoulder, then you can start, what do you call that technique? We just call it the scraping technique, Sharik, where you take the wing of the device and we typically turn it up full blast, like as far as it'll go, right? Or as far as much as the person will tolerate. And we start, what do you call that technique? Like a gua sha, or what do you call that?
Well, if you're using terms that we use here in the Western world, you would call it vibration-assisted soft tissue mobilization. If you were over in the Oriental side, you'd call it vibration gua sha, which is just speeding up the communication through all the mechanoreceptors in the skin and fascia.
Perfect. Okay. So if we're talking about a shoulder, then yes, you could start at the feet and work your way up, or you could also start in the hand and work through all the fascia, all the fingers, all the way up the arm into the elbow, into the shoulder. But then also, I think something really important to note is into the cervical spine, into the neck. Because oftentimes the shoulder refers to the neck and the neck refers to the shoulder. I know that anytime I'm working on a condition in the shoulder, I'm always looking at the neck. But now what I'm learning is anytime I'm working on the neck, I also need to look at the shoulder. And conversely, if I'm ever working on a low back, I'm always needing to look at the pelvis and the hips. I always go down to the knees and the ankles too. But conversely, if I'm working on a hip, I'm always looking at the lumbar spine. So it would essentially be that same type of mechanism. But I think maybe something to add in here, if you want to discuss a little further, would be the resonant cycles, right? So you've got the various cycles on this, the blue, green, red, and white, and being able to literally wrap that onto the joint. We do this all the time. So we wrap a joint while we laser it, and we let this cycle. So it's providing that input after we do that technique. What do you think about that?
I like that a lot. One of the things that people would like to know, both from your device and our device, is that they are calibrated very well to the harmonic range that improves bone healing. In particular, we're talking about the purring range of a cat speeds up bone healing by 66%. And that ability to speed up the healing of bone and bone tissue and connective tissue speeds up the healing in osteoarthritis and also in degenerative arthritis of various kinds. But if you can do just as you were saying, strap the device, scrape first to wake up the connections, and I like to use it on red, which is our wake-up call for the central nervous system. Red is the fastest way to push the button to get the brain to pay attention to an area. Strap it onto that area, put it on red for a time, and then put it on green or blue, which brings it back into a balance. What our device is doing when you've got it on an algorithm is going through about 3,000 calibrated energy points in the harmonic field that speeds up healing. So when you put it on red for 5 or 10 minutes, it just wakes up the brain's connections. Put it on green or blue, it just puts it into a harmonious state where the nervous system says, I'm going to direct a lot more attention down to that area. And we have seen it work over and over and over again with many types of degenerative bone conditions.
Yes. And then, so that's brilliant, right? So you can increase the metabolism, you can increase those osteoblasts and whatnot in the joint and the bone. And then what's phenomenal is then we actually have the frequencies in the right wavelengths to actually talk to those cells, right? So we have a bone setting, we have, settings that are specific to inflamed joints, right? And so you can activate that tissue, and now we can literally begin to fuel those cells, so that they can heal faster, more effectively. This is clinical, this is, anecdata. I've literally seen discs actually rehydrate on MRIs after using lasers in our office. My MRIs would be a great example. I've seen degenerative joints literally reverse, right? And again, this is anecdata, this is my own clinical experience, but I have seen that whenever you start to do these techniques and you do them consistently. So that's the power of using something like photobiomodulation, you can literally fuel these cells so that they can do whatever it is they're supposed to do better, more efficiently, faster, get you out of pain faster, begin to rebuild tissue. It's amazing. I mean, it's literally just amazing what you can start to see in these chronic conditions that, otherwise they tell you, hey, there's nothing that you can do. Here's your meloxicam, here's your whatever. And I'm not saying, whatever about pharmaceuticals. I'm just saying, hey, there's other options, and actually very good options that are well rooted in the literature. And that's just what we see. So absolutely amazing things.
On the note of chronic conditions, we had a question come in about suggestions for using laser for CRPS and nerve damage.
Okay. So laser for CRPS, we have to be very specific with this. So CRPS is multifactorial. We need to, first, number one, understand that. And when we say CRPS, we're talking about chronic regional pain syndrome. It used to be called RSD, reflex sympathetic dystrophy. This is what I'll refer to as a central pain syndrome. So it may have started from a local type of pain. You twisted your ankle, you broke your wrist or something like that. That's relatively mundane. But because of various factors, this now begins to wind up in the brain, in the central nervous system. And to take it to the furthest extreme, think about phantom limb pain. So someone that has this debilitating pain condition in an extremity, let's just say my arm, because it's visible, that they say, I can't live with this anymore, I'm going to amputate my arm. And so amputate the arm, they wake up, they still literally feel their arm pain. So that sensory map, that pain syndrome is centralized, it's in the brain. And so when we begin to work with CRPS, we need to take this central to peripheral approach. So we first need to start working with the laser in the parietal lobe area. That's where the sensory hub is for the brain. And so if it's my right arm, we begin to use, and I typically start to use infrared. And this is a huge reason why I love our 975 nanometer wavelength, because it does things differently than the 808 nanometer, which is what I've typically used in the past. I'm so excited about having this. So we would start in the parietal lobe. We would then go to the cerebellum, which is, it would be on the same side of the extremity, so the right side. And then we would laser through the spinal cord, and then we would go into the local tissue, right? This is very important to understand. Now, from there, I mean, we could expand it even further. We need to look at gut. We need to look at other type, liver, spleen, like there's all types of protocols that we could get into from there. But with CRPS, it's so important to take that central to peripheral approach. I've had much more success with doing that. That's just my experience, but we've had a phenomenal outcome. We have phenomenal success stories with CRPS and using lasers, and of course Rezzimax as well. I don't know if you want to talk through it from a Rezzi perspective.
Oh, you bet. The most important thing for people to understand with CRPS and those types of conditions, including trigeminal neuralgia, that are central brain problems. The most important thing that we find is that you have to stay away from the area that has the brain's attention. You must find areas that send messages to the brain that are not so fired up. Those are the pathways that we use to build a stronger landscape in the brain that helps it fight against the chronic regional pain issues or the trigeminal neuralgia, for example. We may, if it's on the right side, we may never go and treat the right side, but we might start working on the left foot and the right foot and sending messages up to the brain from all kinds of other spots that are not painful, giving the brain lots to pay attention to. And it's very helpful if you can provide the right kind of nutrition, which the light energy does, to the brain at the same time to help it organize itself. As the brain starts paying less attention to the CRPS, it starts to open up the world for the brain, and it pays less attention to those painful signals. It starts enjoying life again. That's our big approach.
Yes, and I'm so glad you brought up the trigeminal system. The trigeminal system modulates head and face pain, but also full body pain. It's a big pain regulating hub. And so even if someone presents with right ankle, CRPS or some kind of centralized pain syndrome in the extremity or something like this, we're using the Rezzimax to co-activate that trigeminal system. So we're still vibrating the face, the mouth, the tongue. We're using the Rezzi to activate the vagus nerve. And that's our co-activation with the lasers to then start to laser into the brain through the mouth, all of these areas again, because I want to have a big influence on that trigeminal system. Something that you're going to see with CRPS is every one of these people come in with primitive reflexes coming back, right? And that's a whole nother discussion. But when you start to become hypoxic, so you start to get reduced blood flow into the brainstem in these areas of the brain that we know occurs because of the literature on how chronic stress impacts blood flow in the brain, these reflexes start to come back. Why? Because they're trying to activate the brain. And so we're using those strategies as well, right? So the trigeminal and vagal system are huge when it comes to any kind of CRPS. In fact, what I'll say, I've got this right here. I'm glad I had this little thing above here. So this is the this tip that comes with the Rezzi. We'll put this on, and then this is literally just a little earbud that you use to silence things so it's not so loud. We'll turn it on, and we'll actually put that in the symbicontia. So the symbicontia in the ear is connected to the auricular branch of the vagus nerve. It's a sensory patch for the auricular branch of the vagus nerve. Now, this is amazing because there was a study, it was for rheumatoid arthritis. I know that's jumping from CRPS, but the study was for rheumatoid arthritis where they vibrated the symbicontia. And in the study, just by vibrating the symbicontia, it reduced inflammatory markers, reduced autoimmune markers, reduced subjective pain scores, etc. So that alone can help treat CRPS, and that is a huge co-activation strategy. So when I do that, I will then use the laser. I'll use it on the areas of the brain. I'll use it on the areas of the gut. I'll use it on the local areas because it's improving blood flow there. It's a huge co-activation strategy that is not going straight to that super painful inflamed area like Dr. Sharik was talking about. Huge, huge, huge impacts with that.
Okay, excellent. Thank you. So interesting. Okay, my doctor told me I may eventually need a hip replacement. Can Rezzimax and laser therapy help delay or even eliminate the need for a hip replacement?
Seen it. Yeah, I mean, I've literally seen people that I've seen more knee replacement than potential hip replacements, but the number of knee and hip replacement surgeries that people literally what I'll say is they do get a home laser, right? So because they need consistent therapy. And they're using photobiomodulation on a daily basis, and they are absolutely avoiding a surgery. Now, I'm not saying that that's what the recommendation is. Of course, go with your doctor's recommendation, etc. But I will say I have seen it clinically. Sharik?
In personal experience, let's see. In my personal experience, I have seen it greatly delay the need for a joint replacement surgery. Sometimes in this day and age, it's hard to completely avoid it. In some cases, we do see it avoided completely, but in other cases, it's delayed by 6 to 7 years if you use a real good targeted vibration on those joint areas. But in this day and age, 6 to 7 years delay in a joint that needed to be replaced immediately under recommendation of the medical teams, if you can delay it 6 or 7 years, it is phenomenal in a person's ability to recover from that. Those hips, a knee replacement, for example, lasts about 25 years. Well, if you're very young and you plan to live to at least 100 or so, or 104 like my grandmother, you want to get as far as you can before you absolutely need surgical intervention there. These tools can help you greatly enjoy life and climbing and hiking while you're waiting for some of the technologies to perfect themselves in case you do eventually need that.
Agreed.
Okay, so there is a question in the chat about someone with a traumatic brain injury and how they can benefit from these devices and treatments.
Traumatic brain injury, you're speaking my language. We don't have enough time for me to get into this. Same thing with Sharik. Okay, so yes, I guess one thing just from a laser perspective that I'd like to point out is that there was a study, I forget when it was done, probably 2018, maybe 2016, something like that, that time frame. It was a Harvard researcher, and the conclusion of the study was that photobiomodulation should be the primary modality used for brain injury. And I think that's important to note because fast forward to 2024 and we're still not there. The majority of recommendations are still rest and wait. They're really not great recommendations. So the benefit of using photobiomodulation early in traumatic brain injury can be huge. I wrote a whole chapter about this in the book that I'm about to publish because there's something called an energy crisis. And this can occur with mild, moderate, or severe brain injury. And what happens, I always talk about like if there's an ice storm in Texas, right? So I'm not in Utah, so we're not used to ice. So in Texas, when we get an ice storm, what happens? Everyone goes inside, they turn on the heat, and we start getting rolling blackouts, right? We start taxing the energy grid. Well, this is what happens in a brain injury. The brain, while it's only about 2% of your body weight, it uses about 20% of your fuel resources. So it has this really high metabolic demand. That's when it's not injured. When it's injured, it has an even higher energy demand to start to rehab and heal these areas. It's very taxing on the energy grid. And if we don't have a mechanism to actually supply that energy, to actually help recover from that initial energy crisis, we can literally see someone stay in the energy crisis for weeks, months, and even years. So I'm even talking about chronic traumatic brain injuries coming to me years and years later, and they're still stuck in this energy crisis. Or maybe they've rehabbed to a certain place and they've hit a plateau and they can't go beyond that. And it's literally because they're still in this energy crisis. So using laser therapy, any stage of a TBI, but especially in those early phases, is so important when it comes to rehabbing a traumatic brain injury. And we have so many different methods. We have blood illumination, where we're hitting the carotid arteries, the vertebral arteries. We can use it transcranially. I'm looking at pilot studies right now, doing them myself, going through the eyes, right? So that's something that we're looking at. We're trying to formulate dosages and all of these things. And we're using, I'm doing this with a neurooptometrist and an ophthalmologist so that we can calculate dosages for the optic nerve and the retina and all these things. But that's a direct path into the brain. We're seeing phenomenal results with this. But I mean, I could go on and on about how photobiomodulation should absolutely be the primary modality for any type of brain injury. I see it day in, day out. I can take this laptop through my office right now, and you're going to see brain injury after brain injury and how we're using lasers on every single one of them. Rezzimax is on every single one of them for coactivation. I mean, this is literally going on outside of my door right now.
So, I apologize. I was looking at several of the comments as we were going and following along with your excellent explanation. But can I address one of the questions that came up
Please.
in the chat real quick? And that was about what would we do specifically on a specific case of trigeminal neuralgia? What would we do with the tuner and with the laser at the exact same time? And you're going to talk about laser. I'm going to talk to you about the tuner really quickly. We will start at whatever level the patient can tolerate, and we'll probably be working on the opposite side of the face, the opposite side of the body. We may have to start at the toes because they may be too sensitive to handle anything above chest level. We're going to find out what a patient can handle, and we're going to start sending stimulus in. Eventually, I'm going to want to get this cool little mouthpiece in there, our newest little innovation, because I
Yes.
want to organize the cranial nerves even further, and I want to organize them with eye movement at the same time. And I want to do it with taste, because I want to engage 10 of the 12 cranial nerves in one simple little exercise. We will do that, but not right on the first day. We're going to start organizing and sending messages through all the safe spots. But specifically, where would you send the photobiomodulation messaging to help organize for a trigeminal neuralgia? Let's say it's a right-sided case.
Absolutely. So we're going to talk about entry points into the brainstem because we really need to fuel those areas of the brainstem. And when we're talking about the trigeminal nuclei, this is the largest group of nuclei that spans the entirety of the brainstem. It's the only nuclei that does go from the bottom to the top, from the medulla into the pons into the midbrain, has its largest organization in the pons, but it does span the entirety. And so what we need to understand is that the entry point is going to be the vertebral artery. The vertebral artery is going to go right up into that brainstem area, can be accessed right behind the earlobe. So we would put the laser right behind the earlobe, trying to do that blood illumination strategy so that we begin to perfuse and really bring back to life, revive that brainstem and start to modulate all these inflammatory mechanisms, et cetera, in the brainstem. And as far as settings go, we have a vagus nerve setting. If someone, I see that someone specifically said the Avant laser in there, right? So I've got in NeuroSolution, we have a vagus nerve setting. I don't know specifically what you're using otherwise. We also have specific brainstem settings in there, but we can also use like a solfeggio setting. In the 528 laser, we're making even more specified laser settings that are going to talk to these brain regions and pain syndromes even more specifically. So I'm actually refining that even further. So you said a right-sided trigeminal neuralgia, right? So I would start like what you just said on the left. Okay, so I'd actually begin doing the perfusion, do the blood illumination on the left. I would then go to the right. I do actually want to go through an open mouth. So through an open mouth, we have a great access point for the pons specifically. So the pons and the medulla. I do want to go ahead and get that entire brainstem. So I do want to hit the midbrain. Now, used to, I would go through the nose, but I didn't find that as effective. And so what I started doing instead was going through the temple, and I would just have a certain angle, right? And if you put the laser like directly on the temple, you actually get that angle that you're trying to achieve. And that's going into the top of the midbrain. This is a big reason why I'm doing the transretinal pilot studies, because if I can go through the eye, go through the optic tracts, and it would obviously be for a shorter duration. And this is a huge, huge, huge reason why I wanted the 975 as well, because we're not using that bright red wavelength. But if I can do that, it is a straight shot. You know, those optic tracts go right through the midbrain area. So this is a phenomenal application there. Again, I'm working on that. That's a pilot study we have going on right now. We're going through the temple, but those are the access points. So right behind the ear, behind the earlobe. So if you were to like press the earlobe down, that area that it touches, this is an amazing access point for the vertebral artery for blood illumination. And you can shine through an open mouth with an upward angle to hit the pons and the medulla, and then through the temple for the midbrain. I will also point out, we have great results whenever we literally just laser over the face. We definitely don't want to forget about that. I mean, there are point and shoot applications. This is one of them. So if you have that painful area on the right, I will echo what Sharik said. Let's start with the left, right? Because remember, photons are a type of sensory stimulus too. They actually are. Like, they are literally talking directly to your mitochondria. Your mitochondria are literally receiving these messages. It is acting like a sensory stimulus. So then we will move over to the right and actually laser those specific areas as well. Do always like to laser the cervical spinal cord. I've just seen that by doing that, we have a greater effect. Good stuff. I feel
What
like we
about
needed,
long?
feel
Oh,
like we
yep.
needed 3 hours, Sharik.
We need 3 days.
Yeah.
What about long COVID? Any benefits for long COVID?
Oh my goodness. Yes. Who wants to go first?
We could go for hours on this one. Let me tell you, one of the most important things we've seen with long COVID is it causes a dysfunction of vagus nerve.
Yes.
That is what all of our treatments are. In order for Brandon's treatments and my treatments and all of these things to be successful, we've got to optimize function of the vagus nerve. And that poor little nerve was kind of disconnected a bit in parts from COVID. And so everything we're doing with all of our patients right now is energizing the GI system and reorganizing cranial nerves so that it disappears. The energy management problem disappears. The lack of taste and smell and some of these other sensory systems that have gone offline in the COVID long haul, they disappear when you carefully reconnect everything and give it the energy to start being able to function again. So the first thing that we do is start using smells and tastes. Look at the cranial nerves that are involved in those senses. We start getting the eyes to function again with the rest of the systems. And we do a lot of work with those cranial nerves in organizing the tongue and its 4 cranial nerves and the ears. And, all of these sensory systems need to go back online, and we see great success with that. Brandon, you can speed up the process. Show them how.
Absolutely, my friend. I think both of our devices speed up the process, which is why they're so powerful together. I mean, it's just amazing. There's a reason why we wanted to do this first connect call with you. It's because it's such a brilliant, collaborative effort between these modalities. So I've actually been able to develop what I call like an immune protocol, and this has been very effective for long haul COVID. It's been effective for autoimmune issues. It's been effective for so many different things. And what we'll do is we'll laser certain tissue types and organs, specifically focusing on the thymus. So the thymus, not the thyroid, the thymus, which is like our master immune gland, right? And what you'll see with aging is that the thymus gland actually shrinks. And there's various protocols, supplemental protocols, glandular extract protocols that I've used clinically that rebuild the thymus and help people recover from chronic illness, autoimmunity, this kind of thing. But what I really noticed is when I started to laser it, people started kicking autoimmunity like crazy, and chronic infections like crazy, and other things that I could talk about. But we try to avoid certain topics that begin with a C. And so we laser the thymus gland, the liver. Okay, so your liver is huge. It does so many things. It's filtering, it's our detox systems. It's a huge organ that we need to take care of. The spleen, which also helps mature our red blood cells. It helps to mature parts of our immune system, etc. And then I'll laser through the gut. We all know that the microbiome is hugely involved with our immune system. And Dr. Peck was doing a beautiful job talking about how we have to be applying stimulus to the gut for long haul COVID, etc. What we need to also understand is that light sculpts our microbiome. Okay. There's a reason why we have this huge brain, we have this heart, we have this gut, right? And it revolves around how a certain nutrient called DHA, docosahexaenoic acid, which is a part of fish oil. There's a reason why we have high concentrations of that in our brain, in our heart, and in our gut lining, aka the enterocytes. DHA takes light and transduces it into a DC electric current. This is why we have the brain we have, the heart, the gut, etc. So if we want to have a true impact on our microbiome, we have to consider the light story. We have to be applying the right wavelengths of light that talk to these enterocytes so they can heal, so that we can actually have a healthy microbiome. So our gut's not inflamed and we don't have this broken down, this leaky gut, that all of these things going on that you see in any type of chronic disorder, whether it's long haul COVID or whatever, right? So that's why it's so important to employ the right wavelengths of light at the right frequencies, etc., in order to really overcome these issues of chronicity. The interesting thing with COVID, this is a coronavirus. It was called corona because of the corona of the sun. And they essentially, one of the initial reasons for calling it that is because if you had adequate sun exposure, you would have corona would have a less impact on you, right? So this is a seasonal cyclical thing, like every coronavirus. But what they did is they changed the verbiage to COVID, lose the corona, nix the whole light concept. I'm not going to dovetail too far into this, but we do know there is a correlation with proper light exposure reducing COVID. There are studies on this. There was a study that came out initially, and what they did is they would laser the lung fields, and they did actually laser over the manubrium and the sternum. I remember seeing the protocol. I know the guys that actually put this together. And then I believe they lasered on the back. They also lasered the lung fields, and I believe they lasered through the oral pharynx. They actually did see a reduction in COVID from that. I was actually talking with a hospital in COVID. We were going to a hospital in Dubai. We were going to replicate this during COVID. It just became it was too difficult. The logistics wouldn't allow for it. But there was high interest in using lasers to actually help people overcome COVID. And now we have this situation of long haul COVID, which again, it's a light story. We can have a huge impact using the proper wavelengths of light. I could go on, but yes, huge impact with long haul COVID for sure.
Okay, excellent. We are coming up on time. There is one question. We have about 10 more minutes, five to 10 more minutes. But wanted to just acknowledge John's question in the chat, whose wife Beth has had nocturnal seizures 1 to 3 times a year, with neurologists coming up short as to solutions or why. And so they have a Rezzimax. You give some other context there, but they have a Rezzimax, but we need guidance. Just learned red light therapy can help from a friend, so he'd like to learn more.
Okay, so they have a Rezzimax. So Sharik, do you want to start in on that, and then you can walk them through that, and then I can walk them through some considerations with laser, since they already have a Rezzi?
You bet. One of the most important things is probably daily finding the weak pathways to the brain, meaning the weak muscles, the weak parts of the body, and sending a lot of stimulus through those. So typically, to simplify, if a person is right-handed, we may send 20 minutes a day of input from the left side of their body to help strengthen the right brain connections. What we see in seizure activity is typically it's a part of the stress response, and it typically goes back to a couple of events that were very traumatic on the nervous system, and so it gets into a pattern. Well, we take a person out of that pattern by strengthening the weakest parts of the body and brain with messaging that helps it not have to go into that trauma pattern, if you will. And that's one of the most important things that we do. We have seen individuals that, for example, a fellow that his wife would have nocturnal seizures. We taught him a spot on her hand. He could place the device and it'd take her right out of the seizure, and she would remain asleep and sleep through the night. But these are typically what we've learned is using the weak side of the body to strengthen those pathways so that the nervous system doesn't fall into the seizure pattern, if you will.
Brilliant. And what I would say is what you just described, I always say it like this. I say muscle tone is a direct reflection of brain tone. So what he's saying is you can find these weaker areas in the brain because they reflect in the body, right? So whether you're looking at reflexes, muscle tone, movement patterns, etc., right? That's a huge window in, because when you really ask the question, what is seizure activity? Well, it's abnormal electrical activity in the brain. And what we're finding, and there is a study that was going on in Cuba, I haven't checked in on it to see what the status is of it, but they tripled the size of it, is that they found that unintegrated or underintegrated brain networks, actually they found low-level paroxysm. So paroxysm in these networks just means abnormal electrical activity that typically precedes seizure activity. And so your wife may actually be walking around with paroxysm during the day, and then when she goes to sleep, for some reason, right? Whether it's the microglia are active, the lymphatic system is activated, something causes this weakness, right? And these brain networks are trying to fire at night. Then you get that seizure spike, right? Think of seizure spikes as like sparks, right, occurring between these electrical connections. And in this study, again, it was in Cuba, what they were finding is as they were integrating the brain networks, seizure activity was reducing and paroxysm was being eliminated. So that alone is groundbreaking, just understanding that if we can identify weaknesses in the brain, areas of under integration, integrate them, we can actually see seizures begin to go away. And I know that's a huge statement, but we see it time and time again. I never set out to treat seizures, but because we treat so many brain injuries, we see a lot of seizures come in our door. And when we use these strategies, and there's a whole host of them that we use, this is the simple form to discuss in. We literally see seizures begin to reduce and then eliminate. Now, there can be autoimmune considerations, and especially with the nocturnal component, there is the glymphatic system that is highly active at night. So when you're awake, your brain is active, it's producing metabolites, waste products, etc. You go to sleep, think of like the street sweepers coming through and cleaning out all the debris. This can trigger some inflammation in people, especially if there is some neuroautoimmunity going on. This is where laser therapy actually shines, pun intended. So what I would do is I would actually have someone do blood illumination before they go to sleep, right, to actually improve blood flow, start to modulate inflammatory markers. It actually modulates the immune system. And that's so simple. You do the carotid arteries, you do the vertebral artery. There are strategies also where we could talk through lasering on the head specifically. I will say I think it's important to work with someone well-versed with all of these types of things. So if you're not working with a qualified functional neurologist or someone that knows how to really walk you through this, I do think that's important. I will also say with seizures, we do want to start with those longer wavelengths of light. We want to start with 975. We want to start with 808 because the longer the wavelength, the lower the electron volt, right, per photon. The electron volt is basically the intensity of the photon, right? So the longer the wavelength, the lower the power per photon, essentially. And that's where we want to start someone with seizures. We want to start with those longer infrared, near-infrared wavelengths of light before we start progressing them to a higher intensity red, violet, green, etc. They can get there, and we definitely use red and shorter wavelengths on seizure disorders, but we want to make sure that we start with those longer wavelengths first. That's key. If you flood the brain of someone with seizures too fast with these high energy photons, you can see seizures start to uptick, and it's transient. I will say, it doesn't say, but it's never fun to see that. So that's just something else to really understand. We didn't even talk about primitive reflexes, Sharik, but this, using the Rezzi for primitive reflexes, I just have to bring it up because when you see someone with seizures, when you see someone with brain injury, they're going to have these reflexes come back. This is a magnificent tool, a huge coactivation strategy to work on these reflexes and then laser, right? So we'll use them on the hand, on the face, on the back, anywhere you see these reflexes, we'll use it to stimulate the reflexes. And then we'll use a laser either over that local body part or on the corresponding brain region to help integrate the brain faster, which is another strategy that one could take with, you know, this type of situation. It's really the same discussion that you had. It's just kind of a different concept.
Love that.
You know what? I can't end without saying, sorry, seizures again. There's a huge amount of research with activating the vagal system for seizure disorders. Phenomenal tool for activating the vagus nerve. You can use it on the vocal cords and the semiconcha, like I was saying, hold it on the gut, and using that as your co-activation strategy for the laser, which is huge. And then the trigeminal system, there was a great study done. It was for pediatric epilepsy. The trigeminal system actually reduced and actually eliminated seizure disorders in pediatrics. So using the vagal with the trigeminal stimulus coupled with photobiomodulation is a very powerful and winning solution for seizure disorders.
Thank you so much, Brandon. Thank you so much, Sharik. We have come to the end of our time, but I wanted to take just a few minutes before we close to tell you about some promotions and special offers that we have going on right now. And so we have a slide to show, but so I wanted to let you know that 528 Innovations right now has a limited time pre-order sales event happening where you can save up to $3,000 off of our laser therapy system. It is, we are in pre-orders, but there is a option for you to get in line for Q1 delivery, so early next year on your, you can get in line for Q1 delivery when you pay in full, or you can choose a down payment option and to get in line for Q2 delivery. And so all of the details can be found on our website. So be sure to visit 528innovations.com to see more details and review your options there. And then this Friday, actually, we are launching a special promotion to close out Pain Awareness Month. So for a limited time, while supplies last, we are offering a free Rezzimax Pain Tuner Pro 2 kit with every pay in full pre-sale purchase. So this is the first group to know about this. This is the only offer that can be combined with our current promotion. So do not miss out on this. You will not want to miss out. And so again, that's launching this Friday. We're going to send a follow-up email with all of these details in it. So, but take a moment right now. I'm putting a link in the chat, or you can scan this QR code to fill out our quick 5-question survey. And one of you will be entered, or all of you who fill it out will be entered into a drawing to win this Rezzimax Pro 2 series kit. Again, no purchase is necessary here. You'll just complete the survey and then you'll be entered to win this.
One thing to throw in, Megan, I didn't touch on this, but I think it's so important to also let everyone know, right? So in 528, we're actually developing programs to help people walk through, you know, whether it's pain conditions or whatever, right? Because what we always get asked is, hey, I have this amazing device. How do I use it, right? And so we're wanting to actually give someone the ability to actually walk through step by step. Here's a setting, here's where you use it, here's how, you know, the duration, all of these things. And what we're going to be doing with Sharik is we're actually going to be creating programs combining the Rezzimax, right? So that's going to be something that I'm super excited about. And I just wanted to throw that out there because I didn't mention it, because that's a huge thing, right? So great opportunity there.
Absolutely. Yep. Lots of innovation going on. So thanks for throwing that in, Brandon. Yes, we have a recording of this and we will be sending it out after. So last thing before we say thank you is that we have Sharik and the Rezzimax team has offered a very, very great opportunity. Just for being here today, you can access this course, a online Rezzimax certification course, just for free. It's a $200 value, and this course provides training for the basic and many advanced techniques with the Tuner Pro 2 and the new Tuner Mini, and is an incredible asset for learning the fundamentals of these revolutionary therapies. So this thank you will be available for 7 days. So you need to register in the follow-up email that we send out. There will be a link with all of the access information. So keep an eye out for that. Thank you for attending email that will be coming out with the recording link and all of these details. And we are so grateful for your time today, Sharik and Dr. Crawford. And we thank you for attending.
Yes, I'll just echo that. I know everyone's super busy today. And again, I'm really thankful. I mean, this was an amazing turnout. I'm so thankful for everyone's time, your interest. Sharik, thank you so much for taking time out of your day. I'm very appreciative for everyone to show up today. I mean, we're all passionate here. The 528 team is exceptionally passionate about helping everyone that is suffering, or really just helping people to optimize their lives. And I know that that mission and that purpose is echoed by Rezzimax. So that's again why we wanted to, kick this off with your team, Sharik. So thank you so much for having an amazing team, for having an amazing product, for just being an amazing human yourself.
Thank you. Thank you. It was an honor to be invited to be a part of this. Thank you.
Awesome. All right, everyone, y'all have a great day.